Okay, guys, it's so good to be here with you. Thank you for having me. Dr. Pedraza said, my name is Stephanie. I'm a nurse. I'm an NFP instructor. I'm excited to be here today to talk to you about fertility awareness. Can you hear me? Okay. All right, I'm just going to start with a little intro. Oh, wait, I need to click here too. Okay, I got it. There we go. Okay, so this is just an intro to me. This is my family. My husband Chris and I have been married for 9.5 years, and we have 4 kiddos. So that's Claire, Henry, Greta, and John. And we have been personally using NFP our whole marriage. Since we got engaged, we took a class actually in the Marquette method, which I teach. So that was roughly 10.5 years ago that we learned, and have been using it ever since. So these are the fruits of our NFP. Just a little background on my education. So I am from Georgia. I went to nursing school in Georgia at Mercer University. They're not very well known except for basketball. Maybe you've heard of them for that, but otherwise it's a pretty small school, kind of like this one, kind of like the size of this one. I went to I did my state board exams here because we moved here shortly after we got married. So I have been working in the children's ER for almost 10 years now. Marquette University is where I did my Marquette training, so I've been doing that for about 4 years. So that's my background. Okay. All right, so first I want to just define fertility awareness method. So the term Fertility Awareness Method, or FAM, is often interchanged with NFP, or Natural Family Planning. So you might hear me say either or. But both terms are referring to the process of tracking a woman's biological signs. So women do this for really 3 main reasons. One is health monitoring. Actually, the American Academy of Pediatrics and the American College of Obstetrics and Gynecology considers the menstrual cycle the 5th vital sign. And so, a vital sign being something like blood pressure or temperature or heart rate tells you a lot about your body and how healthy it is. And it can also give you warning of something that may be that you might need to look into further. So health monitoring is one reason that people will track their fertility. And then the 2 obvious reasons, either to achieve pregnancy or to avoid pregnancy. So I'm here today to talk to you guys because in my work as an NFP instructor, I've met so many couples, and they always say, no one ever told me this. I didn't ever learn this in school. And I just think it's so important for all of us, guys, girls, to have a good understanding of our fertility and just the knowledge to be able to cultivate or care for the body that God has given us. So that is why I'm here. I'm gonna show you some embarrassing photos of me in college. So I was kind of just like you. This is me around 2010, 2012, and I scoured Facebook to find these, but here they are. So college is such a time of exploration, the encounter of new ideas, new philosophies, and one of the new philosophies that I encountered when I was about here eating ice cream was theology of the body. So I went on a retreat with a couple friends from school and just sat in this talk, and he was telling us all about theology of the body, and it rocked my world. I was just like, wow, this is amazing. I've never heard of anything like this. And so I just started reading, and the first thing I read was a book by Christopher West called The Good News About Sex and Marriage. I don't know if you guys have heard of it. It's right there, so feel free to take a look when you're done. It's pretty easy to read. It's in a question-answer format and just essentially addresses the church's stance on sexuality. And it was actually so good that I brought it on a trip that I went on with just my dad. And so I'm like on the plane, like trying to hide the cover of this book. And he's like, "What you reading, Stephanie?" And finally I was like, "I don't even care. It's so good. Like, I'm just going to tell you what I'm reading. It's fine." So he saw it, and I was like, "I don't care. This is fascinating." So what is theology of the body? Theology translates to the study of God. And so the idea of theology of the body is that our bodies matter, that they're good. They're not bad, they're good, and that they point us to the God who made us. So you can see Christopher Rest says it well right here. He says, to say theology of the body is simply another way of saying made in the image of God. Our bodies offer us, if we have the eyes to see it, a profound study of God. Just as a work of art points to the heart of the artist, so too does the human body point to the heart of God who made us. So, in light of that, we're going to jump in. First, we're going to talk about the science, and then we're going to go through the methods that are currently available for natural family planning. And then we'll talk a little more about theology, maybe with a little help from your theology professor, because that's not what I'm best in, but I'll do my best. All right, so we'll start with the science. Oh. Did I turn it off? Sorry, guys. Is that at the top? Oh. Oh, it says it's flashing around the battery, maybe? Oh, that.
Yeah. If not, how about the arrow?
That will work great. Oh, no?
Maybe not.
Okay. Brief intermission. Okay, arrow?
Okay.
Got it. Can I move it right here? Does that work? Okay. All right. The science. Let's start there. All right. So the anatomy of the female is right there at the top. So this is what you would see inside of a woman's pelvis if you opened her up. So she has the uterus, which is this triangle-shaped muscle. Coming off of that are the fallopian tubes. And then right below those are the ovaries. The ovaries are housing your egg cells. So the egg cell or the ova are the major reproductive cells of the female. A woman is actually born with all of the egg cells she'll ever have. So hundreds of thousands of eggs are in those ovaries at birth. But obviously she's not releasing them until later. So when she hits puberty, she starts cycling. And what happens each cycle is she releases one egg from the ovary at a time. And so that egg is going to kind of mature, release, and then it's going to come up out of the ovary into the fallopian tube. And it lives for about 12 to 24 hours, and then it dies. So if it's not fertilized in that time, the woman will shed the lining of her uterus, and that usually does take a little while, about 14 days, for the woman to get her period post-ovulation, if it's not fertilized. But if the egg is fertilized, then the zygote is going to come down the fallopian tube and implant on one of the 3 walls of the uterus. And then, 9 months later, you have delivery right through the birth canal. The photo below is a cross-section of the ovary. So that's just to show you a little bit more about what's going on inside. All of the little circles are eggs. Now you can see as it gets bigger that each egg is surrounded by something called the follicle. The follicle is like the house of the egg. It's like this fluid-filled sac that's going to help the egg grow and mature. And eventually at ovulation time, it will rupture, and you can see the egg is out, and it's on its little path through the fallopian tube. The follicle is still important. It's going to collapse into this gland called the corpus luteum. And the corpus luteum is important because it makes the hormone progesterone. So there are 2 hormones that your ovaries make that we're going to talk about. Estrogen is one. It's made from the developing follicle. And then progesterone is the second, made from the corpus luteum. Progesterone helps sustain pregnancy. So that's why it's made post-ovulation. So the corpus luteum will continue putting out progesterone until your body decides, okay, I'm not pregnant, and so then the corpus luteum shrivels, and then you're going to get your period. But if you do get pregnant, that corpus luteum is going to be pumping progesterone for a long time, till about 14 weeks gestation, when you're through your first trimester of pregnancy. So a very important part. Okay, I think that's it on there. All right, males. Pretty straightforward, also intricate and beautiful in their own way, but for our purposes, it's pretty straightforward. So they start making sperm at puberty. They're made in the testicles. They're not born with sperm. They start coming at puberty. And men release millions of sperm at a time, so they're always fertile at any time. They can fertilize an egg. The other cool thing is that sperm can live for up to 5 days in a woman's body. So, we said the egg only lives for about 12 to 24 hours. Sperm can live for 5 days before that. So technically you're fertile for a little bit longer. If you do the math, that's about 6 days total that you're fertile. And you guys know this probably, but the egg cell plus the sperm cell equals baby. So when you're looking at the phases of the menstrual cycle as a whole, it looks like this. So there are 3 main phases. The first is a pre-ovulatory infertile phase. So it starts with your period. There's potentially a little infertile time after that. That's going to depend on the woman because there's a lot of variability in when you ovulate. But it's going to go, well into the cycle, and then you're going to have this fertile phase, and you're going to ovulate, the egg will die, and then you're infertile for the rest of the cycle. So this is just a general picture of what that will look like. And again, there's a lot of variation. You may be a little bit earlier ovulated, a little later.
Is the last one the same as like the luteal phase?
Yes. I'm glad you said that because I meant to say that on the other side. So you'll hear people talk about the follicular phase or the luteal phase. So follicular phase being when the follicle is maturing pre-ovulation, and luteal phase being when that corpus luteum forms post-ovulation. All right. So how does it all happen? Hormones. Hormones are chemical messengers for the body. And for ovulation, there's a particular component of your endocrine system called the hypothalamic pituitary ovarian axis. And so there are 4 major hormones in this, and they're called luteinizing hormone, estrogen, follicle stimulating hormone, and progesterone. 2 of them are released from your anterior pituitary gland, which is at the base of your brain and essentially communicates with your ovaries in a series of feedback loops to make all of this happen. So we're just going to go through that. At the beginning of your cycle, your pituitary is going to release follicle-stimulating hormone. This hormone is going to basically wake up the follicles. Now, you go through anywhere from 10 to 20 follicles per cycle, but only 1 releases an egg. And so let's say this right here is the dominant follicle. So the follicle-stimulating hormone is going to go and say, all right, wake up, let's go. The follicle is responding, and as it stretches, you can see that estrogen begins to rise. Remember, the stretching follicle produces estrogen. And so estrogen is going to continue to rise and rise and rise, and it does a lot of things for the body. It's going to build up the uterine lining to help potential implantation. It's going to help build up cervical mucus to help support sperm getting to where they need to go. And it's also just going to help mature the egg. So estrogen's doing a lot of good things. Once it gets high enough, it's going to go back to the pituitary and say, all right, we're ready, and luteinizing hormone will surge. And we call this LH for short in the NFP world. So LH surges, it's a quick up and down, and it stimulates ovulation. So you see it surges, then down there at the bottom, the egg is coming out, and then the follicle collapses, and you have your corpus luteum. And then corpus luteum makes progesterone, so you're seeing it rise here. And in this example, she doesn't get pregnant because her progesterone drops. The corpus luteum shrivels up, and then you start back here at square one. So that is how the hormones work. Do you guys have any questions? Okay. All right, this is just a little more on the variability of the cycle, just to illustrate it, really, that the fertile phase can vary so much from woman to woman, from cycle to cycle. So, you'll hear most people say, oh, you ovulate on day 14, and you may. If so, your fertile phase probably looks something like that. But if you're an early ovulator or a later one, could be in those ranges. And these are all considered normal. None of these are alarming to me. Some people just have a little shorter, a little longer cycle. So the purpose of Fertility Awareness Method is to track the beginning, the peak, and the end of the fertile phase for the purposes of hormonal monitoring or achieving or avoiding pregnancy. And there are a lot of ways to do that. The 3 main fertility indicators are mucus, urinary hormones, and basal body temperature. You'll see those in most NFP methods, 1 or 2 of those. So we'll talk a little bit more about how to determine your fertility. The primary way is actually by a transvaginal ultrasound. So you can see the collapse of the follicle into the corpus luteum on a transvaginal ultrasound, which is not practical for NFP. But it's very helpful to know that that is where all the research has come from, is women who've done serial transvaginal ultrasounds, and we've gotten information on, okay, how are your hormones correlating to the actual time of ovulation, and how are your mucus and temperatures correlating to this actual time of ovulation. So, helpful, just not what we're going to be doing in these methods. A secondary indicator is going to be more like objective, like a hormone level, estrogen, LH, and you can also test progesterone and FSH through some of the newer monitors. And then a tertiary indicator is going to be more symptoms-based, so things like mucus, temperature, cervical position, and then sometimes things like mood or libido or what's another thing? Ovulation pain, just a little bit more subjective, but still very useful in knowing where you're at in your cycle. So I'm going to go a little bit into the methods here, just so you have an overview. Calendar methods. You've heard of probably the old rhythm method. The rhythm method essentially assumes that you have a very normal 28-day cycle and you ovulate on day 14. And so the modern use of calendar methods is primarily via apps. Clue and Flow are two of the most popular. But some people just literally look at their calendar like, oh, I'm probably ovulating because I'm 14 days in. And again, you may or may not be. Some people are very regular and they just know, yes, that's when I ovulate. But, there is a lot of variation. So yeah, a little more on calendar methods. They don't rely on any fertility indicators, but just on the length of cycle to guesstimate the time of ovulation. And then slight adjustments may be made. Some of the apps are a little more advanced to make a little bit of an adjustment based on the length of a woman's cycle, but usually it's just basing that, like roughly off of how long her cycle is. So those are calendar methods. The Billings ovulation method is one of the first methods. The first time that mucus was noted as a potential fertility indicator was in 1948. There was a researcher named Eric Obledad, I think is how you say his name, and he was studying mycoplasms in the genitourinary tract, and he noticed that the mucus changed throughout the cycle, and he said, maybe there's something to this. So Dr. John and Evelyn Billings kind of had read some of the research and decided to create this new method called the Billings ovulation method. So Dr. John Billings started it, his wife joined him. They were Australian researchers and they came to the US in 1972. Well, the method came to the US in 1972. So Billings is a single index model of NFP. It utilizes cervical mucus. So basically you observe the sensation at the vulva and note visible mucus when you're using the bathroom. Women use their own vocabulary for these observations, so there's not like any standardized way to describe the mucus. You just kind of know based on what you've seen. It utilizes 4 simple rules that can be used at any stage in life. And instructors do take a teacher training course and have supervised practicum. So that's Billings. The Creighton model, so this is what Dr. Pedraza's wife teaches. It was developed, it kind of piggybacked off of Billings into a more standardized and an advanced mucus tracking model. And so it's also a single index model of NFP. You rate your mucus with very precise examinations throughout the day. They have a lot of different ways to classify your mucus. The descriptions, again, use specific methods and terms. The training is through certified instructors, so people have to do extensive training to become a Creighton instructor and keep up with continuing education. The cool thing about Creighton is that they have something called NAPRO technology. So providers, MDs, PAs, NPs, rely heavily on Creighton charts to help diagnose and treat women's health issues. So if you're really having trouble getting pregnant or something like that, NAPRO technology, which is short for natural procreative technology, can help you. So that's kind of part of the Creighton model. All right, symptothermal is actually been around in various ways for a long time. So I think the first time that they noticed that a thermal shift was a factor in your fertility was around the 1930s. So it's kind of evolved over time. There are so many different groups that have developed protocols like couple-to-couple league, Serena, taking charge of your fertility is another one. And this monitoring includes cervical mucus, basal body temperature, and cervical position. Temperatures can be taken every morning with just an oral thermometer, or now they have some wearable thermometers. So TempDrop is a very popular one. I know like the Apple Watch has some monitoring now. I don't think there's enough research on it to say if it's really effective yet, but more technology is coming out to monitor your temperatures and kind of take an average, sync to an app, that kind of thing. So research has shown that double-check methods are more effective than single-check methods, so that's one of the pros of a symptothermal method. And then there are also thermal-only methods. just one in particular that's become very popular, and this is sort of just a calendar app plus temperature. So there's no mucus monitoring, there's no cervical position monitoring. Natural Cycles you may have heard of. It's pretty popular. They use just like a calendar app plus temp monitoring, and there are different devices available. So they have like the Oura Ring. Apple Watch syncing is very new with them, and they also have a basal body temperature, it's self-guided. So there's not really necessarily a protocol other than like kind of keep up with your app, make sure you're inputting your data, and interpret it yourself. There aren't really instructors in this. Okay, so the Marquette method is the one that I teach. This one is from 1985, and it utilizes the Clear Blue fertility monitor to measure urinary hormones, estrogen and LH. Studies are currently underway for the usage of the Mira monitor. I don't know if you guys have ever heard of that one, but it's a newer monitor, and it also has the capability of testing FSH and progesterone, so that's kind of cool. Clear Blue is going to give you qualitative readings, low, high, or peak, based on your fertility. Mira is going to give you quantitative readings, so it will give you numerical values for each hormone, which is very cool. Also very expensive, so that's that. But it's very cool that we have this as a potential option. So for Marquette, you can use the monitor alone, or you can use it in conjunction with mucus and temps. So the instructors are trained in all three. It does require instructors to be healthcare professionals. I would say Marquette's biggest pro is that the breastfeeding protocols are particularly helpful. I have several clients who come just because they're in the breastfeeding transition and they're like, I don't know what's going on. I really just want some sort of objectivity to this time. So that's Marquette. All right, pros and cons of the methods. Mucus-based methods, low cost, so nice, just natural, right? You don't have to pay for anything. It's great. Can help identify hormonal imbalances. We talked a little bit about creatine, NAPRO technology, those kinds of things. It can be a little bit difficult to use when a woman experiences constant cervical mucus, but protocols do exist to identify a basic infertile pattern, so some people are able to adapt. That's kind of like a check/X, not necessarily a full X. Medications, illness, and breastfeeding can impact quality and quantity of mucus. And so, like I said, sometimes with breastfeeding, people want a little more objectivity and they come to something more objective. But yeah, that's the mucus-based method. So that would be Billings and Creighton are the two major ones available. Symptothermal-based methods, that's the temp drop right there in case you're interested. So it just goes under your armpit and takes an average of your temperature throughout the night, or you can use the basal body. Also low cost, right? You just have to pay for the thermometer. The temp drop's a little more expensive, but it's a one-time cost. Double check methods, typically more effective, at least based on the research, than single check. But temperatures, if you have a fever, it's going to throw off your temps, right? If you're working night shift, that might be a little more challenging. If you are breastfeeding, you're waking up every 2-3 hours, also a little more difficult. So those are the major cons of a symptothermal-based method. So Marquette is considered a high-tech calendar method. So basically the monitor is combined with a protocol to make the method effective. So the main pro is that it's objective. You don't have to interpret things yourself. Can help identify hormonal imbalances because you are testing hormones. So you're tracking them directly. Cons, it costs more. You have this ongoing cost of test strips, right? And then the concern of waste, right? So you're just always stocking plastic strips and throwing them away. So that's the other con, I would say, of a monitor-based method. All right, everybody always wants to know how effective these methods are. So I work with a group called Vitae Fertility, and Louise, my boss, has put together these charts. So this is just based on the research that is out there currently. I meant to bring my book with the studies, but I don't have it. So feel free, I'll give you my email at the end, and feel free to reach out if you're ever interested in looking at the studies a little more. But these are your published NFP methods. So this is more than a case study. This is actual research. Marquette is there at the top. So perfect use is in dark green. Typical use is in light green. So it actually is the lowest for perfect use. and then the highest for typical, and you can kind of just look at the differences. More objective methods are a little bit harder to do typically, so that's why those numbers are a little bit lower in the typical use, but with perfect use, all fantastic. And I'm really not, I am a Marquette instructor, so I am admittedly slightly biased, but I'm not here to tell you that one method is better than the other, because I know people who use all three of these right below and love them and swear by them and have had great success. So I really don't think that there's one method that's perfect for everyone in the world. I think that you kind of have to discuss your pros and cons and figure out what's best for you at the stage you're in. So that's that. All right, I'm going to switch gears a little bit and talk to you about contraceptives. And since we're on efficacy, we're going to talk about contraceptive efficacy next. So this is another chart on perfect and typical use of the major contraceptives that are out there. So the pill, IUD injectables would be like the depot shot, condoms. Marquette is there just to kind of be a comparison. And then withdrawal is the other one. So like pull out is what a lot of people would call that. So this is really to show you, a lot of these, a lot of the NFP methods are very comparable. Getting ahead of myself. Very comparable to the major contraceptives that are out there. So just to debunk the theory that NFP doesn't work, it actually can. It actually can be very effective if avoiding pregnancy is what you're shooting for the time. So that is that. All right. This is a really common question that we get as NFP instructors, as Catholics, people of faith. Isn't NFP just another form of birth control? And really the difference is that you're working with your fertility when you're using NFP or Fertility Awareness Method instead of against it. Modern progress and technology are good, but only in the measure that they are done with respect to the order established by God. Fertility is not a disease. It's not a disease that needs to be treated. My roommate in college was like, Stephanie, well, what about ibuprofen? Like, will you take ibuprofen? I'm like, yes, if I have a headache, I'll take ibuprofen, right? But I'm not going to try and fix something that's not broken. So when we are reverencing the way that God made us, we're giving or allowing him to have the power himself. Simcha Fisher is an author. She wrote a book called The Sinner's Guide to Natural Family Planning. And I'm sure this is borrowed theology, but she says that there's a difference between being non-procreative and anti-procreative. So non-procreative being, I just don't choose to be intimate when I'm fertile, and anti-procreative being, I'm trying to stop it from happening entirely by adding something or taking something away. So that's the major difference there. Okay. So let's talk a little bit about hormonal contraception. We're going to do kind of a deep dive into hormonal contraception. We're going to start with the biological side of things and finish with the theological and why the church teaches what she teaches. All right, we're going to start with the basics. I'm not a chemical person at all. My husband's a chemical engineer, so this gets him fired up, but don't ask me what any of this, I can't explain the structures to you or anything like that. The point of this slide is to show you that the structure of a hormonal contraceptive is different than the natural hormone that is in your body. So hormonal contraceptives are usually a combination of a synthetic estrogen, so you can see the names here at the bottom, there are several, and a synthetic progestin, so you can also see the names there at the bottom. Sometimes it's a progestin only, so that's another option that you'll hear that called the mini pill, so that's another form of oral contraception. How does it work? If you're familiar with the pill, for example, the prescription usually works as like a 1 month set of pills. The first 3 weeks are hormones, and the last week is sugar pills. It's a placebo. And the purpose of that is to kind of elevate your hormones and then simulate a period. So when the hormones drop, you bleed. And this is really called a hormonal withdrawal bleed. It's not a true period. A true period happens when you shed your uterine lining because the egg was not fertilized. So this is different. But a lot of people don't know that it's not a period. They think it is a true period. They think that they're just not getting pregnant and they're still having periods. That's why women who have very, very heavy periods, or even teens when they're younger, they go to their doctor, they say, I have really debilitating periods. They get put on the pill, and they're like, oh, my period's so much better. Well, you're not having periods. You're having hormonal withdrawal bleeds. So just interesting tidbit that a lot of people don't know. So you can see how this is different, being on the hormonal birth control versus the natural ebb and flow of your hormones. There are 3 mechanisms that hormonal contraceptives use to inhibit pregnancy. The first is just that the levels are constant, and so it inhibits the release of eggs from the ovaries. So that's the first mechanism. If that doesn't work, then the next step is progestin will thicken the mucus, so the sperm can't actually get to the egg that's released. The next thing is that progestin causes a thinning of the uterine lining. So if you do happen to break through and ovulate and the sperm make it, and you have fertilization, the baby won't be able to implant. And so it's, in that way, a bit of an abortifacient. All right, what about for medical reasons? Can I use the pill for medical reasons? This is a really common question as well. Interestingly enough, I was doing a little research before this, and when the FDA first said that you could use the pill, 1950, 60, somewhere in there, it was only for cycle regulation. It was only to be healthy for medical reasons. It wasn't for trying to achieve or trying to avoid pregnancy, which is interesting. And then they changed it several years later. Anyway, on average, 70-80% of women experience at least one type of menstrual dysfunction. So things like irregular cycles or really heavy bleeds or endometriosis. PCOS is very common now. Really painful cramping, premenstrual syndrome, PMDD, premenstrual dysphoric disorder is another one that's not on there. The most common treatment for these issues is a hormonal contraceptive. If you go to your OB, that's what they're going to offer you most of the time. And so these essentially stop your cycles by tricking your body into thinking it's pregnant, and so your hormone levels are just elevated and the feedback loops are cut off. And the problem with this is that a lot of these dysfunctions are actually caused by excess estrogen. So giving you more in the form of a combined oral contraceptive is not going to help. The other problem, even if you just go on a progestin only, is that you're just putting a Band-Aid on the problem. You're not getting to the root cause of it. You're not going to fix it. So these are serious problems, but there are other ways to address them. I brought another book right here, Period Repair Manual. It's actually written by a naturopath, and she gives a lot of alternatives for dealing with these kinds of problems. So I often refer to that for clients with difficult cycles. You're welcome to flip through it if you're interested. All right, health risks. So constant artificial hormones interfere with the natural flow of your body. This is just kind of a illustration of all the feedback loops that are happening to coordinate ovulation. So the positive feedback receptors in your body can become damaged if you're constantly on hormones. You know, if a teen, for example, is put on birth control at 14 and she's there all the way until she wants to get pregnant, say at 30, she could potentially have a lot of trouble. So these receptors can become damaged. You can experience problems with hormone regulation in the future. And common side effects are low libido, hair loss, weight gain, elevated blood pressure, nutrient deficiency, decreased thyroid function. I actually have several friends who have gotten off the pill because of these things. They just hated how it made them feel. So those are the more minor ones. There are also some bigger ones, and I put the research here for you to be able to reference. One of the biggest ones is anxiety and depression. So there's a large Danish study done of women over 14 years showed a 23% increase in anxiety or depression from being on hormonal contraception. And it doubled if they started in adolescence. That's pretty crazy. Breast cancer as well. Another large Danish study, 20% increase in breast cancer for women on hormonal contraceptives. If you go on American Cancer Society's website and look under Class 1 carcinogen, right by tobacco and asbestos, you'll see combined oral contraceptive, which is crazy. No one tells us that. Venous thrombosis, I have two friends who had venous thrombus, had one of those, had a clot, because of being on birth control. They had to get off of it, and they had to learn fertility awareness. So none of this is intended to be fear-mongering or scare you into doing something that I think you should do, right? But I do think it's really important to understand that it's not really a biologically good idea to put artificial hormones into your body. So these are just some big examples of why. No one wants hormones in their chicken, right? Mm-hmm. So that's why the chicken's there. So that kind of sums up the biological side. We're going to jump into the theology. All right, when you don't have a degree in theology and you're making a presentation, you open page 1 of the Bible and page 1 of the Catechism, and you're like, okay, let's start here. So that's what I did, and turns out it worked out well. So one of the questions that a lot of people are asking in middle school, high school, college, why are we here and what are we made for? And that's right here. So God created man in the divine image. He created male and female. He created them. Why? To share in his own blessed life for love. And he is constantly drawing us to himself, to seek him, to know him. There are a multitude of ways that we do this, but today, since we're focusing on sex in particular, we're going to talk about marriage, the setting that the church promotes as, or promotes a sexual relationship within. It's my wedding photo. So marriage has not only been a societally good for ages, but through the church has been elevated to sacrament. So what is a sacrament? A sacrament is a visible sign of God's presence in the world, and it's a source of grace to the couple. So visible sign, that means that my marriage, Dr. Pedrazza's marriage, your future marriages are intended to be an image of God's love for the world. So it's a big thing. It's also a source of grace to the couple. What's a grace? It's a free gift from God. Who likes free gifts? Me. Okay, so your marriage is a source of grace. Pope John Paul II, when he was Pope, did a series of talks that has been summed up as the theology of the body. And so one of the things that he said is the body and it alone is capable of making visible what is invisible, the spiritual and the divine. And so, marriage in a way is supposed to point us, again, to the God who made us, like we said earlier. All right, so why is contraception contradictory to marriage? We're not the first ones to be doing something to try and basically reap the benefits of the sexual embrace without any consequence. This has been happening throughout the ages. So Egypt, ancient Egypt, Mesopotamia, 1550 BC. They would put birthstones into the birth canal, would make their own spermicides with herbs, pessary of crocodile dung. So all kinds of things. Coitus interruptus, so that would be the withdrawal that's still used today. Ancient Greece and Rome, plants, cedar oil barrier, copper salt. So copper is a teratogen. Copper IUD would do a similar thing. Mechanical barriers. So modern birth control kind of started around the 19th century. In Britain, it became, politicized. So methods such as condoms and diaphragms were relatively successful in preventing pregnancy, and there was a 29% decline in the birth rate within a generation. And then in the US in the 1950s, clinical trials started for the first hormonal contraceptive to regulate cycles. And in 1960, it was FDA approved for use as a contraceptive. By 1965, a quarter of women in the US were taking it. So it really just shot up. So contra means against, and ception, pregnancy, right? So contraception means against pregnancy. And as all of these, particularly as all the hormonal contraceptives were coming out, people were slowly starting to accept it. So at first, it was just widespread, most people didn't accept contraception and thought it was wrong. And then slowly different Protestant churches and groups were saying, okay, it could be responsible, it could be the responsible thing to do. The Catholic Church has always said, no, it's not the best for your marriage, for your family life. So in 1968, Pope Paul VI put out an encyclical, because a lot of people wanted answers. They're like, okay, everyone else is saying this is okay. Why isn't the Catholic Church just like finally getting with the times? And so if you've never read this before, I encourage you to read it. It's really, really good. So a lot of the answers came from this encyclical called Of Human Life. Sorry, let me just... I think we already talked about that. Okay. So Pope Paul discussed how sex is an expression of love between man and woman, and this love was created to image God's love to the world. So he said 4 things. He said that God's love and your married love should be free, total, faithful, and fruitful. Free meaning you chose it. You came there freely. You weren't forced. Your mom didn't set you up. Like, you got to choose it. Total meaning you're going to give your whole self to this person, completely, all of you. Faithful meaning until you die, forever. And fruitful means it's intended to bring forth new life. So you can see how contraception can contradict some of these things, right? Total, if you're withholding your fertility from your spouse, you're not really totally giving yourself to them. If it's supposed to be fruitful and you're saying, no, I don't want it to be fruitful, that's, against the nature of what marriage is supposed to be. Another thing that he points out is that God created marriage or sex to be both unitive and procreative. And so in the Catechism it says your union is supposed to achieve the twofold end of marriage, the good of the spouses themselves, so unitive, and then the transmission of life, procreative. These 2 meanings or values of marriage cannot be separated without altering the couple's spiritual life. That's a big statement. It's going to alter your spiritual life if you try and separate these 2 things, if you're kind of acting against the way that God designed you. So just to lay it all out, these are some of the forms of contraception that are used modernly. The pill, IUD, condoms, pull-out, depot shot, diaphragm, NuvaRing, Nexplanon, and sterilization is also considered a form of contraception. Any form of birth control used to prevent pregnancy separates the procreative end from the unitive end, and so now this beautiful expression of love is now harmful. So completely opposite of what we want the marital embrace to be. All right, so this is just a little quote to drive that home from Humana Vitae. Couples are called to support God's design for procreation, not to reject it. The use of contraception or sterilization rejects God's gifts. That is because contraception and sterilization do harm to the nature of married love and the gift of life. They separate the unitive and procreative nature of conjugal relations. So, rejecting God's gifts, I just thought that was very significant. If we are saying, no, I want to just cut this off and make it not work like it's supposed to, we're rejecting God's gifts. Now, this doesn't necessarily mean that I'm rejecting a child. It may or may not mean that I'm rejecting a child. It could also mean that I'm rejecting the opportunity for me and my spouse to say, this is not what's best for us at this time. Let's love each other in a different way, right? So God can give you gifts in a lot of different ways in your marriage, but don't act against the way that you were designed. All right, so the Catholic Church, does she teach that you should have as many babies as you possibly can? No. So in Humana Vitae, he also talked about responsible parenthood, and that was something that in the birth control revolution was a really popular term, responsible parenthood, because that was how people were justifying contraception. So Pope Paul says, conjugal love requires in husband and wife an awareness of their mission of responsible parenthood. You should always do your best to be a responsible parent. But you always need to maintain a correct hierarchy of duties towards God, toward yourself, towards the family, and towards society as a whole. And you should always make sure that you have a disposition of generosity. So that means that with your spouse, you are praying, you are discerning, what, Lord, are you calling us to? What do you want from us, from our marriage? And that you're not motivated by selfishness, right? And that's going to look different for everyone, for absolutely everyone. And that's why the church in her wisdom does not give us a list of this is motivated by selfishness and this is not generous and this is, because they want you to talk to God about it with your spouse. They don't want you to just look at the list and, check the box. Also in Humana Vitae, just cause. So certainly there may be serious reasons for spacing offspring. These may be based on the physical or psychological condition of the spouses or on external factors. The church teaches that in such cases, it is morally permissible for spouses to calculate their fertility by observing the natural rhythms inherent in the generative faculties and to reserve marital intercourse for infertile times. So this is the non-procreative versus anti-procreative, right? If you are denying yourself in your fertile time, that's different than saying, no, I want full access and I'm just going to put something in my body to make it possible to do what I want. Okay. Who likes waffle fries? Me too. Okay, so one of the things about natural family planning is if you are discerning that you need to avoid pregnancy for a time, you're going to be abstaining from something that you like for a period of time, each cycle. And sometimes that's really hard. Sometimes it's not just like frou-frou, flowers and butterflies and we're just holding hands and everything's okay. Sometimes it's really hard. Sometimes you drive by Chick-fil-A and you're like, but I really want the waffle fries. You're going to have to take my arms off the steering wheel. But there is grace in denying yourself something you really, really want out of love for the other person. And so that is what the church is giving us as a gift through fertility awareness, through natural family planning. We have this opportunity to be responsible parents, but also to respect the nature that God has given us. Creighton actually has this thing called the SPICE model that they share with their clients, and it is to illuminate other areas of intimacy that you can foster in your marriage. And there are a lot of other kinds of intimacy other than sexual intimacy. So this is another gift of fertility awareness or an NFP-based method, is that in these times when you're abstaining, we're not saying don't be intimate. We're just saying cultivate a different form of intimacy. So spiritual intimacy would be something like praying together, reading scripture together, going to adoration together. Physical, so we're not referring to sexual, although that could be lumped, but physical in another way. You hold hands, you snuggle up and watch a movie, something like this. Intellectual would be, all kinds of things, depending on your marriage. So my husband, he loves the strategy board games, and I'm not into it. But sometimes I'm like, okay, we need to do the intellectual intimacy, I'm going to do it. So I'll play, a game with him like that. Sometimes for us, we'll read a book that we're both really interested in or wanting to dive into together. Communicative or creative. So it's kind of debated which C you should use. So I just put them both because either one would be fine. But for creative things like, so Chris and I one night we did hot chocolate contest. So we both made hot chocolate and Claire, our 8-year-old, got out of bed because she smelled it, and then she was the judge. So that was fun. So that's just an example of something you can do, create something together. Emotional, listening to each other. So we're also a part of this group called Domestic Church, and so one of the things that they promote is something called couple dialogue, and you don't have to be in this group to do this. It's just, it's something that a lot of different groups promote, couple dialogue. So you can talk about where you are as a couple, where you are as a couple with God, as a couple or as individuals with God, where you are with your children and your children in relation to God and your family. And so that's all pretty obscure, but basically you're talking about what is God asking from us as a family in our marriage, in our parenting, what has been hard in our marriage that you're really struggling with and you need me to kind of meet you where you are? What are you really thankful for in our marriage? What has been a gift? What do you want to thank your spouse for? So things like that. Emotional intimacy, cultivating that, that emotional intimacy is really important. Sometimes too, in using natural family planning, you're able to just naturally see what you need to talk about in the form of emotions, because you're like, I just want to be intimate with you, but I can't. What else? Like, and now I'm just like really angsty, and we need to talk. And maybe there's a reason. Like, why don't I want to have a child right now? What is? Does that make sense? So like, you're just kind of, it brings things up because your nature says, I want to do this thing, but we've discerned that we shouldn't. And why is that? Okay, now we're talking about that. We're talking about what we can do to get to a point where we maybe would want to have a child, or maybe not. But it just naturally calls you to a bit of emotional intimacy. Okay. In conclusion, why do this? It's safe, it's healthy. We talked about that biologically. You get a greater understanding of your fertility. The ability to diagnose health issues is just kind of a natural thing that happens when you're tracking your cycles all the time. A lot of people report that their communication is better when they use natural family planning, and that's exactly what I was saying in the emotional intimacy part, is that if you're not being intimate and you've decided, okay, we don't want to have a baby at this time, you're probably talking about why, and that's bringing up different things in your marriage that you want to talk about. So you're communicating a lot more. Self-mastery, if you deny yourself something, little by little, you usually get better, right? So like a professional athlete is not shamed for going to the gym twice a day. They're training, right? They're training to be better at what they're doing. And so denying yourself in your marriage out of love for the other is going to be a stepping stone toward greater self-mastery. Greater generosity towards human life. So you're just thinking about it a lot more. You're thinking about your fertility, and so you're considering that a lot more. Openness to God's plan for your life, sort of the same thing. So you're communicating with each other and with God, okay, what are you calling us to in this time? Because your nature is pointing you towards this thing that you want to do, and you're discerning, okay, you're using your will to say, okay, is this good or is it not? Okay, I think that's everything there. So a few resources for you if you're interested in learning how to do this, and you don't have to be engaged. You can just be, a woman who wants to track her cycles. These are a lot of the major NFP method websites. Fem Health I didn't mention, but that's a new one that's actually very good. They are doing mucus and LH strips is another option. So it's also an app. They have a lot of research. They have a teen class, so for teens who are having irregular cycles. So that's just a good resource to know about is Fem. And so all of these people can help you learn how to track your cycles in different ways. These are some of the books that I recommend. So this is the one that I read originally. I also really like Edward Sri, Men and Women in the Mystery of Love. If you're really good at theology and really into it, just go ahead and read Love and Responsibility. That's a little bit deeper. Or Theology of the Body. So both of those on JP2's teachings. This is another for beginners by Christopher West. I have that one over there if you want to flip through it. Period Repair Manual, Natural Treatment for Better Hormones, Better Periods. So that is, again, just going to address things like super heavy periods, painful periods, irregular cycles, PCOS, that kind of thing. Taking Charge of Your Fertility, that's the first thing I ever read about NFP. And I think she does a really good job of just explaining how the body works, what temperatures do, what mucus do, that kind of thing. So that's just kind of like an OG resource. And then Fem, I told you about already. Oh, and Humana Vitae. It's a really good one as well. Okay, questions?
First, let's give it up to Steph.